Let me pull up the presentation. And all right, can everybody see my screen? Jamie, can you see my screen?
Yes.
There we go. All right, welcome everybody to our presentation on the DNP program. My name is Dr. Bent and I'm the program director. And you will meet Dr. DiDonato as well. She is the assistant program director. We've been working in tandem, trying to make changes to the program and just, improve the student experience here at the University of Penn. So what is our mission? Our mission at the University of Pennsylvania, specifically for our program, is to prepare exemplary practitioners who will set benchmarks for quality clinical practice, scholarship, and service. We anticipate and expect that all of our students engage in interprofessional collaboration and promote patient safety and optimal health outcomes for patients. Sometimes this is translated in research to inform best practices. So when you are accepted into the program and you know that it's a DNP program, so a Doctor of Nursing Practice program, we will expect that you would finish off your program with a DNP project that would help improve healthcare outcomes for the patients that you take care of. We would also encourage and like our students to embrace innovation that transforms healthcare systems. And we do this by means of diversity and complex populations. So everybody is included in the mission of the university and the program itself. What are our program values? Any program that you're looking at specifically should have some values assimilated with the program and what their anticipations are as far as needs of the students. The program is very evidence-based in curriculum, so everything that you learn here is current evidence as far as anesthesia, education and anesthesia practice. We do anticipate that students will be consumers of quality research. So we ask that our students, anything that you do, look for the evidence behind what your practice is in the OR. We do take a multidisciplinary approach to didactic and clinical education. So you will have the ability to be taught by current physiologists, specifically in cardiac and respiratory, those within the university that are doing current research. They are the ones who teach the research program, research classes, as well as pain content and things of that nature. We try to find providers, not only CRNAs, but providers that are experts in their field and bring them in to teach you. We do use interactive simulation sessions. So today, our third year students, for example, we're doing intubations with pig tracheas, and it's always, one of those aspects of the education that they love the most, doing hands-on information in the simulation labs. And we like to use translation of science into practice. Again, just that evidence-based approach to care of our patients under anesthesia. Everybody will participate in clinical scholarship and professional development. One of the backgrounds to what Dr. DiDonato and I always say is that we want you to leave the University of Penn a better provider and better person all around than you came. And you guys are pretty amazing as it is. So we anticipate that we would produce some very quality CRNAs. So our didactic faculty, you will be taught by numerous individuals within the anesthesia program. This is a list of just our faculty members that are here most often. Me, of course, I teach a lot of the basics to nurse anesthesia, pharmacology, and then once you're in your second year, I am the person who teaches your advanced principles classes. Dr. DiDonato is not on this slide. I think this might be an old slide that we have from a couple of years back, but she is the assistant program director, as I noted. Tracy Flood, Marco, they are all clinical providers of anesthesia in some of the clinical sites that you will be going to. Colleen Wolstowski, she's a lecturer and she leads our simulation program. And Dr. Kimberly Westra and Kevin Driscoll, they are lecturers within the program as well. Kevin Driscoll, such a an added commodity to the university as he works at the NIH and he also is on the board of the NBCRNA, which is one of our governing bodies for anesthesia. Other didactic faculty, Dr. Fleischer has since left his post as the chair of the anesthesiology and critical care department at the UPHS system. Nabil El Kasabani was teaching our regional anesthesia content and some of our orthopedic content. Those didactic faculty that are at the university, specifically Dr. Joseph Libanati, he is a mainstay within our program. He is an expert in physiology content. We couldn't do this program without him, to be honest. He does all of our respiratory physiology, cardiac physiology, renal physiology as well. Dr. Rosemary Palomano, she is our pain content expert. And, you know, just even with the DNP projects in and of themselves, she really steps up and guides the students along. She's an expert researcher as well. And Dr. Heath Schmidt, he does our pharmacology content and he's an expert in that, that area. So a little bit about our DNP program. The mandate was set forth by the COA, which is our Council on Accreditation for all CRNA programs to have doctoral preparation by 2025. Our first doctoral cohort was in 2016, and they graduated in 2019. It is a 36-month full-time program, and again, the plan of study is for your doctor of nursing practice. So sometimes people come in with the asking questions about, can I do this part-time? The program is definitely 100% full-time. It's fully integrated program, so you will get didactic, clinical, and simulation all at the same time. What happens with our program, and some programs are what we call front-loaded, where you get all of your content before you even go into the operating room. Here at the University of Penn, our content is delivered simultaneously with your clinical experience and with your simulation experience. So a lot of the times the students really like this aspect because they are learning as they're going along. The clinical course, the courses are divided into 9 semesters, so again, 3 years, and all of the graduates would be eligible to complete the national certification exam, which is why everybody, you know, comes to school and wants to be in a CRNA program. Along with that, the graduates are able to practice in any state provided an unrestricted nursing license is maintained and state regulations regarding certification and licensure for the practice of nurse anesthesia are met. Even though you graduate in the city of Philadelphia and the state of Pennsylvania, you are able to practice in any state across the country. So what does our DNP program plan of study look like? It is currently approved and accredited for nurse anesthesia program. The contents of the program include didactic studies in pharmacology specific to anesthesia and other medication, pathophysiology, so how does your anesthetic actually influence the pathophysiologic state of the patient, pain management, health assessment, and more, as well as clinical training at many of the clinical sites around Philadelphia area, in Delaware and in Maryland. And we do have subspecialties, including pediatrics, trauma, and pain management. The DNP component includes courses mapping to the DNP essentials. So before you are accepted into a program such as this, you should know what the DNP essentials are, and you should gauge the program that you are going to apply to according to those DNP essentials. They are required for this doctorate, and it includes policy informatics, leadership, project management, epidemiology, population health, research evidence, and a series of courses related to the fulfillment of your final DNP project. This is what our plan of study looks like. I know it looks very hefty, but we break down each of the semesters in sequential order and the courses that you would need to take in order to complete your degree. I'm going to turn the presentation over to Dr. DiDonato so she can complete the rest of the presentation, then we'll take questions at the end.
Okay. So For our DNP plan of study, we require a choice of concentration, which is proposed, and a final DNP project is going to be overseen by your DNP committee, which is assigned to each student. Our students typically work in small groups of 2 or 3, and the deliverable takes the form of a submitted manuscript conforming to the author guidelines of a peer-reviewed journal. So we want you to publish the work that you do. So our clinical faculty are the CRNAs and anesthesiologists who work in the facilities where our students are sent. The clinical ratios per our accrediting bodies are 1-to-1 for CRNAs, 1-to-2 for anesthesiologists. You always, whenever our students are in clinical, they always have support. They're never left, to their own devices. It's a learning experience. And we want you to be successful, so we're not just kind of leaving you flap in the breeze. So we have 8 primary clinical sites, currently 3 pediatric sites, and then specialty rotations that include cardiothoracic and non-cardiac thoracic surgeries. Pediatric cardiothoracic, so we have a specialty CHOP cardiac rotation, of course, obstetrics and trauma. So as you're going through the program, in order to sit for your certification, you need verification that you meet the criteria via all of the skills that you need to earn. So we use what's a tracking system called Typhon that manages all of that stuff. So you don't have to worry about maintaining your own spreadsheets and things like that. Typhon is it's a great program. It's very easy. It allows you to enter in your clinical case scenarios for each day, and then it tallies them for you automatically. We also put your schedules in there too. It makes it really simple. So again, and Dr. Bent also touched upon this, our sim lab is state of the art at Penn. And we've been really, really lucky to have some really great interdisciplinary simulations with many of our faculty, including from the School of Medicine. So we've had international opportunities also in the past. Typically every year we go to Guatemala. We were able to go at the beginning of 2020, just before the world shut down. Hopefully we'll get back. Obviously, probably not this year, but hopefully in the years to come, we'll get back to that routine. So some of the other things that differentiate Penn, we very strongly encourage our students to participate in our professional organization. There's a lot of mentorship around that. I'm the current president for our state Nurse Anesthesia Association. So, it provides an opportunity for our students to kind of see leadership pretty close up. We do participate in student activities with the state organization as well as the national organization. And some of our faculty sit on the editorial board for the International Student Journal of Nurse Anesthesia. So it's another opportunity for our students to be published. We also participate in Nurse Anesthesia Week activities. Nurse Anesthesia Week is typically the 3rd week in January. So, oftentimes we'll participate with the other local schools. So, and this is just some of our past activities for Nurse Anesthesia Week that our students put together. The annual fun run was good. That went for a few years. The picture up on the top left is a group of our students that participated in feeding the homeless for the week. So we have a great location. Our program is part of a premier university, one of the best graduate nursing schools in the country, typically ranked in the top 5 globally. University City is a great place to be also. So our admissions process, we have admissions are open now until the end of October. We are currently going to be interviewing for the cohort of 2022. So we're a year ahead. You need your 2 written essays, 3 references. We would like 1 letter to be from your direct supervisor. All your transcripts, TOEFL if necessary, and then we'll interview moving from there also. Okay, so that we also have information on the website. You want to check out the FAQ section. There's some really specific information there about what we're looking for. So you want to dive into that a little bit. You want to prepare for the time commitment. It's a 3-year marathon. There really isn't a lot of letting up on the throttle until very close to the end. And even at that point, you're then preparing for board certification. So it's a tough pull, and it's a full-time engagement. Our students don't work. They really don't have time to. So you want to make sure that you prepare for that as well. All right, questions?
So if you want to type your questions in the chat box, we can answer them. I also, again, just want to emphasize this upcoming application deadline is November 2nd for 2022. As Dr. DiDonato said, the 2021 cohort is full. So if you are applying this fall, it's for 2022.
I have a question.
So, yeah, the average GPA, I can actually answer this, Dawn. I was just going over this data.
Yeah.
So the average GPA is about a 3.5. But we will say that we don't focus exclusively on that. Obviously, you need to have the skill set in order to be successful in the program. But we've found that, you know, especially people who've been out working for a little while, you know, where you were in college in terms of prioritizing academics may not be where you are right now. So don't let that discourage you.
Emily asked a question that is, what is one quality that distinguishes Penn that a candidate might not know unless enrolled in the program? Answering that question, Emily, I would say that we have a pretty robust student-to-student mentorship program and faculty-to-student mentorship program. And in some ways that does set us apart. We would pair a new incoming student up with a student in the cohort above them, and they kind of show them the ropes and tell them things that, you know, from the student's perspective that they may not know until they would enter into the program. The other thing is that Dr. DiDonato and I and the rest of the faculty are very dedicated to the student's success. So we ourselves have student mentees from each class, roughly 3 or maybe 4 or 5 per cohort for each of the faculty members. And we as well guide you along and through the process of being a SRNA and what it looks like.
So the next question is, how many times a year do we open the application process? 1. How many students are accepted? We accept 28. And we typically start interviewing in January, February, but that was because we were flying people in and seeing them in person. I think now with Zoom, it may be a little bit sooner than that, but probably, you know, January-ish.
Mm-hmm. So Isabel's question was answered, and Jane applied for the ABSN program. So Jane, we'll come back to your question since it's very specific to your situation. John, is an academic reference specifically required? We prefer to see an academic reference only because we want to know how you function in the academic setting. Or do you have leadership skills? Have they been noted during academia, because this is, it's an academic institution, and even though you're in a clinical program. So the answer to that question is yes. When applying, I'm sorry, go ahead.
So I wanted to add, if you are concerned about the strength of your academic reference, you can submit up to 5 recommendations. You don't need to, but if you participated in maybe a research project or a QI project in your professional career, somewhere where you used academic skills in your professional life, that can also complement an academic reference.
Yeah. Kelly asked, when applying, do you prefer a CV or resume? Either or. We look at both of them. So it, don't feel like, because it says resume, has to be a resume. You can submit a CV too, that's fine. Do you have clinical, let me go back up. Do you have clinical rotations to an all CRNA practice? No, we don't at this point. All of our practice in Pennsylvania, and Dr. DiDonato can probably speak a little bit better to that than me, but all of our practice right now in Pennsylvania, in our area specifically, is collaborative with our anesthesiology partners. I don't know, Dr. DiDonato, if you want to add more to that.
So yeah, there isn't anything available in this area right now.
Yeah. Deb, are there any clinical rotations in New Jersey? Yes, there are. We have 1, 2 primary sites that are in New Jersey, very close to the city. Sarah asks, what is the interview style like, and how is the best way to prepare to be successful? I always say be yourself. I want to, and Dr. DiDonato as well, we want to see people in all of their authenticity. And it's difficult to change who you are to match what you think a person wants to see when you're being interviewed. So I would say as authentic as you can possibly be, because once you get here, that is kind of the person that you are. And, I feel like the interview is, I always say laid back, but, students may differ in their opinion of that. But we ask you questions related to clinical practice and your leadership and how you deal with situations, stuff like that. So just be prepared and be authentic in your responses.
So just to add to that a little bit also, is that it's really important. You're stuck with Dr. Bent and I for 3 years, like in a really intense situation. If you don't come into the interview and just be you, it's going to be a long 3 years for all of us, because if we don't vibe, it's not going to go well.
Mm-hmm.
Most of the people who apply are extremely talented, very intelligent, and are more than likely to be successful in anesthesia. That doesn't necessarily mean that this is the place for you. And I'm not saying that we don't, want to hear from everyone, but the people who are going to be really successful and really happy are the people who we share the same philosophy and we have the same expectations. So if you just come in and think you're going to say a bunch of things that you think we want to hear, it's going to make for a long 3 years for you specifically. Yeah. So, well, yeah.
Be who you are. Jamie, Gifty Lordson asks about school fees and international students. I don't know if you want to touch on that or if they should.
Yeah, so our breakdown of tuition and fees is available on our website. This is a loan-heavy program due to the cost. There is some merit aid available for domestic students. International students are typically sponsored by their home country, or they use private loans. And I do know private loans do have payment plans available, but I'd recommend going on our tuition and fees page to view the exact breakdown.
Rayona, I believe that's how you pronounce your name, asks, what is your first time pass rate for the NBCRNA? So all of that data is on the website. Our when we started our DNP program specifically, we had 15 students in the cohort, and our first time pass rate for them was 80%, right at the average for students in the DNP program. Our second graduating DNP class just left in 2020, and their pass rate was 93% for first time pass rate. And we had 28 students in that cohort. Nikki, your website mentions that your DNP program develops competency in organizational structure and function. What does this mean in the context of anesthesia, and how does your program develop this competency? When you are, one, working on your DNP project specifically, and two, when you are in clinical, you will recognize what the structure of organizations are. And we also have courses as far as what those structures look like. Specifically, when we talk about patient safety and quality improvement, you'll see how, just in anesthesia works with nurses within the operating room. It has to work with surgeons and what that relationship would look like. So depending on what your clinical site is and what your focus is, how we meet this is that the students are fully immersed into the organization, not of just the operating room, but the hospital in which you would provide clinical services to. Amber Tran, if I have above a 3.2 GPA and am, except from having to take the GRE for this program, can I still send my GRE scores in? Absolutely. You can 100% send those scores in. Is there a preference for students located within Philadelphia? This is Rayona again. Within Philadelphia over out-of-state students? No. We look at the student's application on a whole. We don't show preference to students just because they live in Philadelphia. If, it's open for anybody across the country. As a matter of fact, we have, over the course of the last 4 years, had students as far as California, even in our present cohort, and as up in the Northeast region as Vermont. So you don't need to worry about the fact that you would think we would show deference just to students that live specifically in Philadelphia. Do you allow students to take any of the required classes for the program before it officially starts? We actually do. We allow students to take up to 5 courses prior to them matriculating into the program. And that would obviously be done once you have been accepted into the program, and we would work with registrar to figure out which courses would be best suited for you to take. That was 2 questions on that. Cecilia asked, does clinical education count as a direct report for your current job? So let me just ask the question again. Are you asking, does clinical educator count as a prerequisite for the program? Like when we ask for 2 years of ICU experience? I don't know if that's what you're asking specifically, Cecilia, if you can, kind of rephrase it a little bit. I don't want to answer it incorrectly. So I'll move on to the next question. Oh, here she is. Oh, as a reference? Yeah, sure. I feel like anyone that you work with, if they are supervising you directly, sure, they would count as a reference for you. So as long as they're supervising you directly. Keely Cunningham, what are some hard skills that students are typically more deficient in when they start the program that you would recommend getting more experience in while waiting to matriculate? Students do struggle, especially students who work in hospitals or units that have an IV team. So as you said, IV insertion is definitely one of them. But those are skills, and we can teach you skills. I always encourage students to learn as much as they can on their units about patients' pathophysiologic disease processes and medication that patients are on and how those medications work, because any of those skills, intubating, IVs, central lines, those are things that we teach you while you're here. Do you recommend taking any classes before you start to apply to make yourself a stronger candidate? I always leave those decisions up to the applicant themselves, because then what happens if I instill my thought process? I don't really have a thought process on this either way, but I feel like students will then start taking classes and then, they get into a, well, Dr. Bent said I should take these classes in this class. So we really leave that up to the student themselves to make that decision, whether they financially can afford to do it, and all of those. There's a lot of things that go into that aspect. If you have a lower science GPA, but have above a 3.2 overall GPA, would taking the GRE be to your advantage? Jamie, I don't know if you want to chime in on this one, but your science GPA is definitely important. And there is an algorithm that Penn does use for the science GPA. So I don't know if the GRE would be advantageous to combat a lower science GPA per se.
Yeah, I would agree. Again, I think this decision is best left up to the applicant. I would say a better indicator is nursing courses and science courses than your GPA. So I would say if you're debating between taking a course and taking the GRE, you may want to lean towards taking a course. Of course, there's financial implications for that and time implications for that. So again, I would leave it up to the applicant. Again, I would try and also find a strong academic reference that can speak to your academic ability as well, if you can do that. I can also,
all right, go ahead.
Sorry, can answer the next question from Maya about can you add recommendation letters once you have submitted an application? So no, you cannot add recommendation letters. However, your current recommenders can submit after you've submitted your application. So if you are just waiting on your recommendation letters, everything else is complete, I recommend submitting now. And your recommendations can come in later as long as they're in by the deadline, and you can send them reminder emails too.
Can you speak to the content of the second essay regarding DNP versus DNAP? So I guess, Veronica, are you asking what the difference is between a DNP and a DNAP? I can answer that question for you. A DNP is just a doctor of nursing practice. It does allow you obtain your doctor of nursing practice degree, and it allows you to, if you are going to work in education or academics or anything like that, you can across the board. If you have a DNAP, that is specific to anesthesia. So you may limit yourself as far as if you chose to, subsequently work in academia, you may not have that robust of experience because it is specific to anesthesia as opposed to a DNP, which is not. Do you hold online programs or only on campus? For the nurse anesthesia program, we are, right now not, but we are an on-campus program. We are an in-person program. There are some programs within Penn that are like a postmaster's DNP, for example, which are online, but the DNP NA or the DNP nurse anesthesia is on campus in person. Is there a particular ICU experience that you prefer for your program? I could tell you what we don't accept, which then you can surmise what is accepted and what is fine. So what is not accepted is any step down experience. So whether it's ICU step down, CCU step down, CT ICU step down, trauma step down, anything that is intermediate is not accepted. ER experience is not accepted either, and PACU experience. We are getting away from taking NICU, and when I say NICU, I mean neonatal ICU experience, because we find that applicants with neonatal ICU experience and no adult ICU experience, or at least older child experience like PICU, that they do struggle a little bit for a while in the beginning, and they get very discouraged. So any of those other areas, MICU, SICU, trauma ICU, pediatric ICU, we do accept those. Anita asks, do applicants with 1 year, I guess, minimum critical care experience stand a chance? Our applicants have 2 years experience. So 1 year of critical care experience, we probably would not even interview you at this point. We do look at 2 years minimum, and most of the applicants within the last 2 cycles have had on average somewhere between 3 and 5 years of experience. Sharon asked, how does it work if someone gets waitlisted? So if someone is waitlisted for our program, we carry a waitlist of approximately 10 to 15 applicants. And as other applicants who have been accepted decide that they cannot come for whatever reason, it's not the right time for them, we then take from the waitlisted applicants. Do we have vacations per semester, and how long is it? So our students have 6 vacation days per year. They can use them as long as they so choose. Carly, do you anticipate your cohort size changing in the near future? Our cohort size is limited by the pediatric spaces that we have. So unless we, you can imagine that there are 3 pediatric hospitals in our area. And we have 6 anesthesia programs in the area. So all of the schools are vying for those pediatric spots. Unless we have an increase in pediatric spots, then we don't anticipate a change in the cohort size for now. In the future, I mean, years down the road, probably, but not in the immediate future. Brenda asked, how are students matched to clinical sites in your program? We have the cohort above do a clinical site presentation, and they give you the kind of the information on the clinical site, preceptors, what the site is like, and how much independence or lack of independence that you'll have in the immediate time when you are there. And we get the students actually get to choose where their primary sites are. And when I say that, there is some caveat, of course, because if all of the students want to go to Pennsylvania Hospital, for example, we can't accommodate. So we let the students rank their primary choices 1, 2, and 3. And over the past 2 years, I think out of the 48 students in the last 2 cohorts, only I think 1, 2, maybe 4 students have not had one of their top 3 choices. So when that happens, we make, accommodation for them when we do specialty site rotations. How many clinical sites does the average student rotate through? That's a good question, Keely. The average student can rotate through as many sites as they want or as little sites as they want. What is necessary is your primary site rotation, a pediatric rotation, a cardiac rotation, and an OB rotation. And after that, students can do trauma if they want. They can go to the VA if they want. They can go to Hopkins if they want, shock trauma, things like that. But we have students that rotate to just what is needed. And we have some students who like to go to all of the rotation sites. So that will vary based on the student. But if I would use an average, I would say roughly 3 to 4 rotations or clinical sites. Kelly asks, in regards to OR cases, do you find that Penn has to compete with all of the other schools, CRNA and medical students, or is there a lot of opportunity to complete cases beyond the required amount? There have been many opportunities to complete cases beyond the required amount. Right now, our Council on Accreditation has 600 cases as the required cases, and most of our students graduate with an upwards of 800 to 900 cases. As far as competition with medical students, our clinical coordinators at each site, and I wouldn't say it would be medical students more so, but perhaps anesthesia residents, but our clinical coordinators at each site, they work very well with our anesthesia, our medical anesthesia counterparts. And so they have a schedule set forth where, these days are the CRNAs or the SRNAs doing certain cases. And then other days, if the the anesthesia residents need the same type of cases, they make sure they alternate. Accommodations for international students, I probably am not qualified to answer that question.
We don't have specific accommodations for international students versus domestic students. There is on-campus housing available for all graduate students. There isn't anything specific to Penn nursing, so it would be amongst all Penn students. It's really your personal preference. Some people live on campus in graduate housing. Some people choose to live off campus in the University City area or other places throughout the city. In general, Philadelphia is pretty affordable compared to other major cities. If you're coming from New York or San Francisco, you might be excited about the rent prices. If you're coming from a small town, you might be shocked at the rent prices, so it's all relative. But there's nothing specific for international students.
All right. Where are we? Oh, Sharon, go ahead. Dr. DiDonato, you want to take Sharon's next question?
Sure. So OR experience, is it beneficial as ICU experience? I would say no. I don't think that there's anything, not that there's not anything there, but just being in the OR environment isn't enough. That's really going to be super helpful. What the OR nurses do and what we do in critical care are two completely different things. So Brandon, referencing the 2 years of ICU experience, it's at the time of application because you're competing with people who have 2 years experience or above. So you want to make sure that you're competitive with the people that are already applying. Is the certificate internationally recognized? I don't believe so. No, I think you need to have certification in whatever country that you're working in. Are there students in the program who have kids? Yes, there are. I had 4 children when I went through the program. How would you recommend getting an academic reference if you've been out of school for 5 years? So if you've been out of school for a long period of time and you don't have any connection to academia, I would think about, as Jamie said earlier, looking at the nursing educators in the facility where you work, thinking about how, you participate in any kind of quality improvement or staff education or anything like that, so that we can just sort of get a feel for, your teaching and learning style. What do you see your students struggle with the most during school? So I think the most difficult thing that our students seem to come across, and I feel like this is universal, is the struggle of moving from being very clinically competent in what you do to being at the very bottom of the barrel and not very good at what you do at first. So I think that tends to be a really, really big struggle for most people. And it can kind of make it difficult for you to do all kinds of other things. I think Jamie can answer the question for what's considered science GPAs.
Sure. So I will preface this by saying that we understand BSN programs and entry-level nursing programs differ. So you might not have taken every science course that's listed on our application, and that's okay. We know that programs differ. But the courses in the science GPA are typically biology, chemistry, microbiology, anatomy, physiology, pharmacology, pathophysiology, physical assessment. So you'll see those in the application. And again, if they were not required for your BSN program, you do not have to take them, with the exception of statistics. Statistics is required. And you can note that you did not take this as part of your BSN program.
Okay. So if an applicant was previously waitlisted, can you offer any advice? Yes. So we're fortunate that we get a very large number of really, really highly qualified people. And we always want more people than we have the ability to take. So, unfortunately, some of those people end up on the wait list. So anything that can solidify your position, diving really, really deeply into the clinical context of things, working on extra things in your unit, like quality improvement projects or, unit leadership or things like that. There are things that are going to kind of push you above other people. And you can reach out to me directly also if you want to talk a little bit more about that. Yes, we do prefer 2 years of critical care experience by the interview. Most of our applicants have 2 years of experience or more. So that's who you're competing against. So if you apply, the application will come through, but like I said, you are competing with those people. Does having over 5 years of ICU experience, is it a disadvantage? I don't believe that it's a disadvantage. One thing that I think have noticed over time is that people who have been in the ICU for a really long period of time, especially if they've been in the same ICU for a very long period of time, the transition is sometimes a little bit difficult. So if you can, kind of keep that in mind and figure out what you're going to do to ameliorate that, then that's probably a good thing. The participating in international experiences. I've taken groups of students to Guatemala 3 times. Mm-hmm. So yeah, 3 or 4 times. So typically there's a Guatemala trip every year. And we participate with the CRNAs that work at Pennsylvania Hospital through an organization called Hearts in Motion. And that's what we do. Would it be beneficial to have a recommendation from attending intensivists? I mean, anybody who can speak to your professional abilities would be great. We don't assign any more weight to physician intensivists than we do to, nursing supervisors or anything like that. We don't assign any more weight, but anybody who works with you very closely who can talk about your professional abilities would be great. Jamie's probably a better person to answer the question about the GRE.
So the question is, if an applicant scores less than the 50th percentile in the GRE, could they still be considered for an interview? Again, we have a holistic admissions process. We're looking at all parts of your application, not just your transcripts and your GRE scores, but your essays, your recommendations, your backgrounds. So I'm not going to rule it out. It depends on the entire application and also the entire pool of applicants.
The next one, Jamie, is probably for you too. How many applicants do we have per year on average?
Yep, we receive about 140 applicants every year. And I can answer the next question too. The deadline is November 2nd for 2022. When will applications open back up? The application for the next cycle will open July 1st of 2021.
Good. Amber asked, do students with 2 years of ICU experience by the program start not have a chance at being matriculated? We probably will not look at your application if you don't have 2 years experience by the application when you're submitting your application. So that 2 years experience, you can imagine how many applicants, like Jamie said, we have roughly 140 applicants. And the more experience that you have and the more leadership that you can show during your interview, the better off that you are. And we find that with the first year of being in any unit, it's kind of like getting your hands, getting your feet wet, I should say, and getting your hands dirty and what's going on. And there's not a lot of learning that goes on in that in those initial moments because you're trying to figure out just where you are. And then after that, you kind of, set your own tone and figure things out and can delve deeper into pharmacology and pathophysiology and things of that nature. So we strongly look at applicants with 2 years or more experience during the time of application.
For last year's incoming class, the average years of work experience were 3.83 years. So to emphasize what Dr. Ben said, work experience makes a big difference.
Yeah, and this is 2 years off of orientation as well. So keep that in mind when during the orient, we want to see how you function as an ICU nurse by yourself, not with a clinical preceptor that's by your side. Sharon, any specific recommendations to prepare for the program, such as books to read and such? I feel like the clinical experience that you gather in your unit is the best. I can throw out a title of a book, Clinical Anesthesiology by Morgan and McHale, if people are so apt to read that, or Basics of Anesthesia by Stolting. That's a very thin book, thin by nature of, looking at our other textbooks that we have. But sometimes the information that you will look at in those books prior to, coming into an anesthesia program, they just don't make sense. And consider this, that during your interview process, we aren't going to ask you questions about anesthesia. You don't really know that yet. So we're going to ask you questions based on the units that you work in. Ferrara asks, my manager requires her nurse to equally rotate between ICU and PCU step down. We all completed a critical care program and are considered ICU nurses. Is that acceptable for an application? So if I don't know what specifically your unit is called, if it is considered ICU, I think just reach out to me privately at my email address and I can give it to you all. It's fine. It's on the website too. It's bentd@nursing.upenn.edu. A specific question like that, probably reach out to me and we can, thanks Jamie, and we can discuss what that is. Navdeep said, I am currently taking statistics and will finish my class on November 5th. Can I apply before and send faculty heavily focused? Wait, where are we? Oh, I jumped to something else. Can I apply before and send transcripts soon after they finish that class? That's a yes, right, Jamie?
Yep. So for the purposes of submitting your application, upload proof of enrollment in the class, which you should just be able to download from the school, from your student services website, and then send in an unofficial transcript when you're finished.
So Nikki asked a question, what areas and concentrations of research do current faculty heavily focus upon? Since it is a practicing doctorate, our faculty does not necessarily focus heavily on research. So if you look at what a DNP is, we take current research and we implement it in the clinical area. So evidence-based practice that our PhD colleagues have looked at, and that is our implementation into the clinical area as far as patient safety and quality improvement. So that's, I hope that answered your question, but there's not a lot of heavily based research within the DNP program itself. Can a nurse educator be an academic reference? Is that nurse educator somebody that works in your hospital, or is it somebody that works in academia? Anyone that can speak to, like Dr. DiDonato said, if you're so far removed from your university, then certainly, we would look at other references. And as Jamie stated as well, you can submit up to 5 references. So don't feel like your hands are tied in that area. If my GRE is waived, would that affect my chance, I'm assuming, of getting an interview? No. If you have a GRE waiver, that doesn't change your science grades and all of the other aspects of your application that we're going to look at. Selena, what is preferred shadowing hours? We leave that up to the applicant because especially now, it's probably going to be a little bit more difficult in order to shadow with the CRNA in your hospital. we want the applicants to understand what a CRNA does and what a CRNA is. So, and what that might look like. So we actually don't count hours of shadowing and make it an issue for the applicants, because some applicants will have considerably more hours of shadowing, and that's fine. And some, have 1 day, and that's fine too. Cecilia asked, what is the ratio of students accepted to students graduating from the program? Oh, so you're in essence asking us of what our attrition rate is in the program. So last year, all of the students who were accepted into the program graduated from the program. So that was 28 out of 28. Our first DNP cohort, we lost 2 students, but that was for personal reasons of their own. So we accepted 17 and graduated 15. And in previous years, I mean, if I were to, and I've been here at Penn in the anesthesia program for a little over 10 years, I would venture to say that most years we don't lose anyone to attrition, but maybe 1 or 2 over really the last like 10 years or so. So it's not a high attrition rate at all. Is transplant ICU competitive? Any ICU is competitive. I think I listed those that are not accepted: step down units, ERs, PACUs, and we're veering away from the neonatal ICU a little bit as well. All right, and should I just answer the last?
Yeah, there's one more question, so.
Yeah, VA ECMO experience preferred? No. And should we as applicants try to get exposure to complex cardiac devices? We gear the application process and the interview process based on the units that you work in. So if you work in for example, medical ICU, well, I'm not going to, ask you a whole lot of questions on a complex cardiac case because you have not been working in that area. So I would say no. I mean, if you can get exposure, that's great, but don't worry about not having that exposure to complex cardiac devices.
Okay, thank you, Dr. Bent and Dr. DiDonato, for your time. There were some great questions today.
Yeah.
So thank you everyone for asking good questions. If you're applying this year, good luck with your application. We look forward to reading it, and you will get an email usually tomorrow with this recording. So have a great day, and thank you again.